This presentation will provide an overview of the Public Health Act 2016, which received royal assent on the 25th of July 2016. This presentation will provide a general summary on each part of the Public Health Act. A separate presentation is also available on the timeline to implement each part of the Act, which will occur in a staged manner over the next 3 to 5 years. The Public Health Act has 20 parts. It will replace the majority of the existing Health Act 1911, which is now over 100 years old. Key features of the new Act include the use of a risk-based approach using generic terms such as material and serious public health risk that are now capable of capturing any risk to harm. Modern infectious disease provisions. Modern enforcement provisions. Higher penalties. The ability to respond to public health emergencies, and legislation that now introduces public health planning, public health policies, and public health assessments. Part 1 of the Act provides for the short title of the Act, commencement provisions, objects and principles, definitions of relevant terms, and binding of the Crown. The objects outline the purpose of the Act, which include promoting health and well-being and preventing disease, injury and disability, protecting individuals and their communities from risks to health, encouraging individuals and communities to plan for, create and maintain a healthy environment, informing the community about risks to health, establishing responsibility for the administration of the powers in the Act between state and local governments, reducing the inequalities in public health of disadvantaged communities. The objects are referred to throughout the Act to ensure decisions are made within the intended scope of the legislation. The Act includes 5 principles that should guide decisions made and administration under the Act and associated regulations. Sustainability principle, which ensures decisions made today benefit future generations. Precautionary principle, which ensures that where there is a lack of scientific evidence about a possible health risk, decision makers should act on the side of caution until further research is undertaken. Principle of proportionality, which ensures that a health response is made proportionate to the risk, considering the impacts on individual needs compared to that of the wider community. Principle of intergenerational equity, ensuring that we continually invest in public health as a matter of priority. Principle relating to local government, ensuring that local government are acknowledged for their role in public health and are consulted as part of the decision-making process. The Act binds the Crown. This means that the Act covers land held or administered by the Crown and its authorities. Local government will be the lead enforcement agency responsible for enforcing the Act on Crown land. Local government can issue a Crown agency with an improvement notice under Part 18. However, the Crown cannot be prosecuted or issued with an enforcement order. In circumstances where a Crown agency requires more time to comply with the Act, the Crown can seek an exemption from the Minister for Health under Part 17. Exemptions will be discussed in more detail further in this presentation. Part 2 provides for the administrative provisions, including outlining the functions or the roles and responsibilities of the Chief Health Officer and local government, reporting requirements which require the Chief Health Officer and local government to report on their performance or functions under the Act and report on any offences under the Act, and the designation of authorised officers who are responsible for enforcing the Act on behalf of the local government. Part 3, General Public Health Duty. The General Public Health Duty is the key element of the risk-based approach and requires a person to take all reasonable and practical steps to prevent or minimise any harm to public health that might foreseeably result from anything done or omitted to be done by that person. This is the responsibility of all individuals, corporations and public entities, including government agencies. The general duty will be capable of capturing known and current threats, as well as new and emerging threats to the public health. A breach of the general public health duty does not constitute an offence, but does allow for a range of actions to be taken, including the issue of an improvement notice. 4. Serious public health risks and material public health risks. Provides robust offence provisions that use a tiered approach to offences based on the degree of risk to public health. These offences are categorised as either a material public health risk or a serious public health risk. These are flexible definitions that are capable of capturing any risk to public health. Penalties range from $10,000 to $250,000 or imprisonment and are to be determined by the courts. Penalties for body corporates are 5 times the maximum penalty. Part 5 of the Act requires the preparation of 2 types of public health plans: the State Public Health Plan, prepared by the Chief Health Officer; local public health plans, prepared by each local government. Public health planning provides an opportunity to focus efforts towards high public health priorities, enhance partnerships between health agencies and local government, continuously evaluate the health status of the population, get public health on the overall planning agenda. Both the state and local plans must meet the public health needs of the state or local district, examine the health status and health determinants of the population, establish objectives and policy priorities for the promotion and protection of public health and the development and delivery of relevant services, define how objectives and policy priorities are to be achieved, including a framework for the identification, evaluation and management of risks relating to public health in the state, and ensure a process of review, replacement and reporting. The first state plan must be produced 1 year after Part 5 comes into effect, and the local plan must be produced 2 years after Part 5 comes into effect. Every 5 years, both state and local government must review the health status and health determinants, develop a plan, communicate the plan. Each year, the plan must be reviewed, amended as required, evaluated and reported. Local government are already required to produce a number of plans under the Local Government Act 1995 on various issues such as finance, workforce, assets. Part 5 enables a local plan to be integrated into this existing planning. Part 6 provides for the Chief Health Officer to develop and the Minister to issue non-statutory public health policies. The Act enables the Minister to issue policies for any purpose relating to the objects of the Act. It is anticipated that public health policies will be made in respect of broad public health issues that are of particular significance to the community. Governing bodies or industry will be advised to give due consideration to these policies as best practice. This potentially gives them a very wide field of operation, responding to the range of specific issues that either adversely affect the public's health or promote better health across the community. Part 7 provides the framework for the implementation of public health assessments for proposals declared by the regulations to be accessible proposals. A regulation must be developed providing detail on what types of proposals are accessible by the Department of Health. The Act defines a proposal as being part of a project, plan, program, policy, operation, undertaking or development. Regulation will complement the environmental impact assessment process administered by the Environmental Protection Agency. Ensures that human health is actively considered in the planning process. Examples of the type of proposals to be assessed may include mining activities and state planning strategies. Part 8, Registration and Licensing, provides a framework for registration and licensing that can be applied to activities that are declared by the regulations to be public health risk activities. It also ensures that new or emerging risks can be easily captured. Annual fees can be charged by the local government in accordance with the Local Government Act 1995, Part 6, Division 5, Subdivision 2, similar to the operation of the Food Act 2008. Part 9. Notifiable infectious diseases and related conditions is designed to prevent and control the spread of infectious diseases and related conditions. It is a modernisation of the current infectious disease provisions. It sets out 6 key principles that outline individual conduct around preventing the spread of infectious diseases, including: a person who has a notifiable infectious disease must take all reasonable precautions to ensure that others are not unknowingly placed at risk of contacting the disease. A person who suspects they may have a disease should take steps to confirm this. If someone doesn't comply with the principles, it gives rise to further action under Part 9, such as test orders or a public health order. A regulation will declare what diseases are notifiable. Utilises 4 tools to minimise the spread of infectious disease. Notification requirements requires medical practitioners, nurse practitioners and pathologists to make notifications to the Chief Health Officer. Outlines confidentiality requirements or penalties. Orders for compulsory testing, test orders, of persons suspected of having an infectious disease. Orders to require or prohibit specified matters. Public health orders. Measures to identify and inform persons who have or may be affected by or exposed to a notifiable infectious disease. The infectious diseases provisions aim to balance the rights of protecting the community with the rights of an individual. Individuals are provided with a range of tangible rights and safeguards, including the right to receive specified information about why they may be requested to offer a sample, the right to seek legal advice, and the right to appeal to review a test or a public health order. Part 10. Notifiable infectious diseases and physical or functional abnormalities provides for the notification of prescribed conditions of health to the Chief Health Officer, such as cancers. The purpose is to facilitate important public health programs and initiatives which aim to minimise the prevalence of such conditions within a community. It also enables regulations to be made for the establishment and maintenance of registers to record the information. This part has no direct enforcement implications for local government. Part 11. Serious Public Health Incident Powers provides for the exercise of wide-scale, sweeping powers in specified circumstances. Such powers will be used to prevent, control or abate risks from a serious public health incident. Examples may include cases of rapidly spreading epidemics of serious infectious diseases, such as SARS or Ebola, where there is an overwhelming need to take action to protect public health. The Chief Health Officer may authorise the exercise of serious public health incident powers by authorised officers. These powers include requiring persons to undergo medical examination, be quarantined, leave premises, or require premises to be disinfected. Part 12. Public Health Emergencies empowers the Chief Health Officer to authorise the exercise of the highest level of emergency powers during a public health emergency to prevent, control or abate that emergency. This part complements the Emergency Management Act 2005, but is specific to events that only require a response from health agencies, such as pandemics. Such powers include the ability to declare an incident as a public emergency, require premises or areas to be evacuated, powers to quarantine a person or require them to undergo medical testing or treatment. Part 13. Compensation and insurance provides arrangements to address losses incurred as a result of the exercise of the powers provided in Part 11 and 12 related to serious public health incident powers and emergencies. Where a person suffers loss or damage by reason of the exercise of Part 11 and 12, they are entitled to receive just and reasonable compensation from the state. Compensation is not payable if the person contributed to the loss or damage. Costs are recoverable by the person under a policy of insurance, or where the loss or damage would have happened in any event. Part 14 establishes improvement notices and enforcement orders as tools to proactively manage public health risks. These tools support the general public health duty and ensure that the appropriate enforcement action can be taken to protect, promote and improve public health. An improvement notice is an order that either requires or prohibits a person from taking specified action. Improvement notices will be able to be issued on a number of grounds, including the carrying on of a public health risk activity that contravenes any provision of the Act, or the undertaking of an activity that poses a risk of harm to public health. Enforcement orders are the next level of enforcement available. An enforcement order may be issued by an enforcement agency where a person has not complied with an improvement notice, or if it is necessary to prevent or mitigate a serious public health risk. Failure to comply with an enforcement order can lead to prosecution, with a penalty up to $50,000 or a daily penalty of $10,000. Infringement notices are not mentioned in the Act, as all the provisions related to these are contained within the Criminal Procedure Act 2004. The Public Health Act will be prescribed under the Criminal Procedure Act 2004, which will enable new sets of regulations made under the Public Health Act to allow for infringement notices to be issued. Part 15. Inquiries provides a framework for the Chief Health Officer to authorise to conduct an inquiry into any matter relating to public health. Inquiries may result from the initiative of the Chief Health Officer or at the request of the Minister. A written report must be prepared in all cases and submitted to the Minister for Health as soon as is practicable. The report must outline the findings, conclusions and any recommendations. Part 16 provides powers of entry, inspection and seizure, which is modelled on Part 5 of the Food Act 2008 and provides authorised officers with robust powers, including powers of entry, inspection, search and seizure. These powers ensures authorised officers can exercise various powers, including to stop vehicles, enter premises, apply for a warrant to enter premises, seize items, and where necessary be assisted by a police officer or other person. An authorised officer may enter and inspect any premises, in respect of which a registrable or licensable activity is carried on, where the authorised officer reasonably suspects an offence has been or is being committed. Premises are used in connection with a public health risk. Premises contain documents that relate to a public health risk or an offence under the Act. Where the authorised officer reasonably suspects there is an immediate public health risk connected with the premises and the entry is necessary to investigate, prevent, control or abate that risk. Part 17 of the Act provides a mechanism for the Minister for Health to grant exemptions to the Crown and Crown authorities from compliance with the Act or the regulations. Whilst Crown authorities are required to comply with the Act, there will be some instances where it may not be practically feasible to effect immediate compliance. The Act recognises that incremental measures may be required and provides for exemptions. An exemption cannot be provided for a number of parts of the Act, particularly related to notifiable infectious disease, emergency management provisions and powers of entry provisions. Where an exemption is issued, the Minister may request that a compliance plan is developed outlining exactly how compliance will be achieved. Both an exemption and compliance plan must be made publicly available and progress reported annually. Part 18 provides for various technical matters relating to liability and enforcement under the Acts, such as who may commence proceedings for an offence under the Act, certain protections for witnesses in the context of proceedings for an offence, and specified documents to be evidence of certain matters in the proceedings for an offence. Part 18 also provides for an improvement notice to be issued to the Crown and its agencies, unless an exemption has been provided, and that an enforcement order cannot be issued to the Crown. Part 19, Miscellaneous, provides for miscellaneous matters such as fees and charges to be fixed and recovered by local governments. Allow the Chief Health Officer to act as a local government where any place is not within local government boundaries. Information sharing allows for guidelines and regulations to be made. Part 20, Transitional Savings and Provisions, provides transitional provisions in respect of the provisions of the Health Act 1911, such as providing for persons who are appointed as environmental health officers under the Health Act to be immediately designated as authorised officers, and for unpaid rates levied under the Health Act to continue to be payable and may be recovered under the Local Government Act 1995. The Health Consequential Amendments Act 2016 supports the Public Health Act. This Act lists all of the changes that will be made to the 1911 Act and other affected legislation, and provides for the Public Health Act to be enacted in stages as subsidiary legislation is developed. There are no provisions in the Act relating to the making of local laws or the financial cost recovery. All local laws and the impositions of fees and charges will be made under the Local Government Act 1995. The Department of Health will work with the Department of Local Government and Communities and WOLGA to facilitate this. If you require further information related to the Public Health Act 2016, you can refer to the Department of Health website for up-to-date information and resources, and read about the staged implementation of the Act. Download copies of the Act from the State Law Publisher website and refer queries to our email address. Thank you for watching this presentation.